Thank you again for joining us on today's CalPERS webinar, the 2020 Open Enrollment Information for Employers. It is now my pleasure to turn the floor over to your first presenter, Rob Jarzombek. He is Chief Health Account Management Division at CalPERS. Rob, you have the floor.
All right, good morning, and thank you, Phil. And thank you all for joining us on our webinar today. I'm Rob Jarzombek, Chief of the Health Account Management Division. My area provides and support for the public agency and school employers that contract with CalPERS for health benefits, as well as the state of California and the California State Universities. We've heard feedback from you, our employers, that showing you where the open enrollment resources are and what's new for the coming year will help you in planning and will help you in your planning and to answer your employees' questions. And we've developed this webinar to do just that, provide you exactly what you need to know. We hope you find this time valuable. Here's what we'll cover today, with plenty of time to answer your questions at the end. We'll begin with the key dates to be aware of. We'll talk about the changes members can make during open enrollment. We'll walk through what's new for 2021. And we'll show you where you can find member and employer resources to guide you and your employees through open enrollment on the website as well as in My CalPERS. Then I'll answer any questions you may have. You may have seen that our CalPERS website has been updated with the full listing of 2020 health plans and premiums. This information is found on the Plans and Rates page, and we'll show you that in the website demo. You may have already requested a virtual health fair with our health plans. If not, you can do so now. These virtual health fairs will take place September 2nd through October 16th, and we'll show you where you can find that information. On September 14th, health plan statements will be made available along with a health plan search tool, which we'll talk more about later in this presentation. Open enrollment begins on September 21st and ends on October 16th. And you have until midnight on November 13th to finish processing the open enrollment transactions you receive. All right, let's jump into open enrollment for 2020. Open enrollment is the one time a year members can make changes to their health benefits without a qualifying event. During this time, they can newly enroll into a CalPERS health plan, change their health plan, add eligible dependents, and remove dependents. Your active employees do this through you, their employer, and retirees do this through us, CalPERS, as we are the health benefits officer for them. This year, we have some health plan changes coming in 2021. First up, the Blue Shield Trio HMO plan will expand into 3 counties: Santa Barbara, San Luis Obispo, and Ventura. This expansion benefits members in Santa Barbara County in particular, where a lower cost HMO option does not currently exist. Trio is a lower cost, narrow network HMO plan that was added to the CalPERS portfolio in 2020 in 6 counties. And again, will expand into 3 counties for 2021, giving members more choice in the low competition area, such as Santa Barbara and San Luis Obispo counties. Next, we have a provider network change in the greater Sacramento region. UC Davis Medical Group will no longer be available in the United Healthcare HMO Basic Plan. However, UC Davis is still available through Anthem Select HMO, Blue Shield Access Plus HMO, and all of our basic PPO plans. This network change does not affect any of our Medicare plans. Other changes for 2021 are related to Medicare plans. Kaiser and UHC added supplemental benefits to help avoid rehospitalization. These include benefits such as post-hospital discharge transportation and meal delivery, and routine transportation to medical care. A new Sharp Direct Advantage Medicare plan will be offered in San Diego County to allow members to remain in the Sharp network when they become eligible for Medicare. In the service area for Anthem Blue Cross Select Medicare Preferred Plan will expand to 23 counties to give families in combination plans the choice to remain in the Anthem network when they become Medicare eligible. Each year, we proactively send letters to members regarding changes that may significantly impact them to ensure they are aware of how they may be affected. The letters guide members to My CalPERS, where they can research and compare available plans in their health area and find out which plans their doctor or specialist participates in. This year, we're sending letters to members impacted by a 10% or higher premium increase, members who will see additional supplemental Medicare benefits in the Kaiser and United Healthcare Medicare plans, and members who will no longer have access to UC Davis Medical Group through United Healthcare. The first set of letters went out last week, and the next set of letters are going out this week through next week. Members and employers have resources available through CalPERS website and My CalPERS. I'm going to provide an overview of these resources and where to find them, and then we'll provide a demo to show you how to navigate through the information online. One of the key employer resources is our dedicated open enrollment page for employers on the CalPERS website. We update this page with everything you need to know to prepare for and carry out a successful open enrollment for your employees. Each year, this is where you will find resources like a summarized list of changes by plan for the following year, registration for open enrollment health fairs. This year they are virtual due to the pandemic, and the health benefit summary, which is a publication developed each year to provide a general overview of benefits, copays, and service areas for each plan. Another key resource found on the CalPERS website is the Plans and Rates page. Here you will view a full listing of the health plans and premiums for each region in California, as well as out-of-state and association plan premiums. You'll also find the state and CSU contribution amounts on this page. You may already be familiar with employer bulletins. These are an important resource for employers during open enrollment and throughout the year. They are the primary method of communication we use to share information about OE and point you to where to find the resources you need. We begin sending employer bulletins about OE as early as June to communicate important information and continue sharing information with you through October. So far, we have sent employer bulletins regarding the open enrollment health fair information, health plan change information, which is the health plan changes matrix, registration for this webinar, and the mailing date of the member letters. Upcoming employer bulletins will include employer resources and the open enrollment flyer, open enrollment dates and employer transaction cutoff date, and any My CalPERS system downtime. You can sign up for employer bulletins through the CalPERS website, which we will show you during the demo. The CalPERS website is also a great resource for members. As with employers, we have a dedicated open enrollment page for members to find the most up-to-date OE information and resources. You can point your employees to this page by linking to it or by including the URL in your own open enrollment communication. Each year, members can find information regarding open enrollment dates and when to expect their health plan statement, a summarized list of changes by plan effective the following year, and a checklist to help guide them through things to consider when choosing a new health plan. Finally, the most valuable resource for members is My CalPERS. This is where they find customized information regarding open enrollment specifically for them. It's also where they will see special messages based on their own unique situation. For example, a member who is approaching Medicare age and is also in a plan with a premium that will increase by 10% or more next year will see two special messages. One with guidance on what to do and things to consider when turning 65. And the other message would explain that the current health plan's premium is increasing next year. Through My CalPERS is also where your employees can access the Search Health Plans tool. The tool allows them to search for health plans available in their area. It also allows them to include a doctor or specialist in their search. They can then compare the plans of their choosing and see side-by-side differences in premiums and benefits. They can also see what their employer contributes towards their health premium to get a better idea of what their out-of-pocket premium would be. Additionally, and new this year, members can save time by generating a pre-populated HBD12, which is our health enrollment form, through My CalPERS. The form will pre-populate as much information as possible. Then, all they have to do is complete the form based on the change they'd like to make, e-sign the form, and submit it to you, their employer. At the end of this presentation, we'll play a pre-recorded demonstration of My CalPERS so that you can see what this looks like for your employees and for you as a member. Now, I'll show you the CalPERS website and where to find all the open enrollment information and resources I shared with you today. We'll start on the home page of our website, www.calpers.ca.gov. We'll walk through the employer resources first. From here, we'll click on the Employers tab and select Learn About Open Enrollment from the I Want To section. And this is your dedicated page where you can access all the information you need to know about open enrollment. Here you will see the open enrollment date, your deadline for processing your employees' open enrollment transactions, as well as what your employees can do during OE. As mentioned before, employer bulletins are the primary way we communicate open enrollment updates to you. By clicking this link, you'll go to the page where you can enter your email address to subscribe. Enter your email address here, and you'll begin receiving all of the employer bulletins sent by CalPERS. So now let's go back to the open enrollment page. Here we have some content around the 2021 health benefit changes, approved health plans, monthly premium rates, and COBRA information. You'll see that quick links are threaded throughout the page. You'll see here the health plan changes matrix I spoke about earlier. It's in alphabetical order by plan and provides a brief summary of significant changes effective the following year. Below that is information on employer contributions. For state and CSU employees and retirees, we link them to the plans and rates page to view this information. And for public agency and school members, we explain that contributions vary and to contact their employer to find out how much is contributed towards their monthly premium. What you'll see next is the employer roles and responsibilities section. This is a very comprehensive section designed to provide guidance and links to resources that will help you fulfill your role and responsibilities as the health benefits officer and support your employees during open enrollment. We explain what the health benefits officer role is, provide reminders on verifying and maintaining supporting documentation for eligible dependents. We tell you about the health plan comparison tool available through CalPERS for employers. And you can find additional information on submitting and rescinding transactions. In our important open enrollment communication section, and OE resources for you and your employees, such as information from CalPERS, plan statement. Also included is a sample email and a link to the Open Enrollment Flyer, which is intended to assist you in communicating OE information to your employees. Here's the flyer now. You can also find quick links to publications and information on ordering them if needed. Next, you'll see information on requesting virtual open enrollment fair. As mentioned earlier, health plans will begin holding virtual OE fairs September 2nd through the end of open enrollment. So I encourage you to request one if you have not done so already and are interested in doing this for your agency. And lastly, you'll see a 2020 legislation update regarding domestic partners that may affect your employees' health enrollment decisions. Now, scroll back to the top and bring your attention to the right-hand side of the page. Here, we have quick links to much of the information we just reviewed. However, I wanted to cover a couple things in a bit more detail. On the Plans and Rates page, you'll find a full listing of health plans and premiums. This information is organized by employer type. For state and CSU, you'll see the premiums for those members, as well as the employer contribution amount on this page. Then, for public agencies and schools, the premiums by region are seen here. This also includes association and out-of-state premiums. Next, we have the contact information for each plan and a link to view the evidence of coverage documents for them. And then, under the Forms and Publications section, you'll find the health benefit summary I also mentioned earlier. This provides a general overview of the benefits, copays, and service areas for each plan. This is the current year's health benefit summary, and the 2021 version will be available online by September 14th. Now we'll move along to the Debted Open Enrollment page for members. You can get there by using the link on the right-hand side, or from the home page by selecting Learn More About Open Enrollment under the I Want To section, just as we did on the Employer tab. The member page has many of the same features as the employer page, like open enrollment dates and what members can do during the OE period. We remind them that no action is needed if they aren't making changes. Then we explain that beginning September 14th, they can access their customized health information in their CalPERS account, explore 2021 health plans and premiums, and even search for their doctor or specialist. Here, members will also see the full listing of health plan changes along with quick links to their CalPERS account and the Plans and Rates page. In the Things You Need to Know section, we inform your employees that it's important to understand how health benefit changes may impact them and their families. We explain that it's important for them to review their health plan summary in their CalPERS account and review their plan, their costs, and their network before making changes. We also provide several resources with quick links for both active members and retirees to support their research efforts in comparing coverage, services, and costs. Next, we provide important reminders and guidance on changing health plans. We remind them not to use their previous plan after December 31st, and that they will receive new ID cards from their new health plan. We direct employees to their health benefits officer if they'd like to make a change. We also provide information on dental and vision open enrollment, which aligns with CalPERS Health open enrollment period. We guide employees to contact their respective employers for more information on dental and vision plans and benefits. And lastly, we remind members to view their January warrants to ensure the correct health plan premium deductions were applied if they made a change during OE. Below this is the 2020 legislation update you saw on the employer page regarding domestic partnerships. And at the end of the page is a video for members regarding open enrollment. Now we'll go back to the top of the page. Similar to the employer page, we have many links on the right-hand side. I wanted to point out one of the resources I mentioned earlier, the Guide to Choosing a Health Plan. It was designed to be used as a checklist for members when they're considering changing plans. It lists all the various factors to consider, such as costs, available doctors, and covered benefits. It also guides them towards resources to help them learn more about these factors. Then, back on the open enrollment page for members, there is a link to the open enrollment newsletter. This provides an overview of the 2021 health plan changes and guides members on where to access OE information. Here, you'll also find links to the health benefit summary and other publications that may be helpful to your employees. So that wraps up the website walkthrough. Hopefully you now have a better understanding of the information available and where to find it. Before we get to Q&A, let's take a look at the pre-recorded demonstration of a member's CalPERS account, so you can see the open enrollment information available online to your employees. We pre-recorded this demonstration and we'll play it for you now.
For this demonstration, we will view an active state member's CalPERS account. Please note this applies to all state, public agency, and school members, whether they are active or retired members. The views are just slightly different because the information is customized to the type of member. Beginning September 21st, once your employee is signed into their CalPERS account, the home page will display an open enrollment banner which contains a link to direct them to their health open enrollment information. Here, they will see open enrollment dates and what they can do during the open enrollment period. If a member has a significant impact, there will be a special message just for you, providing important information regarding the current health plan they are in and what change may affect them. For this member, the special message indicates that they will have a premium increase effective January 1st, 2021 for their PERS Care health plan. A member can select the Search Health Plans tool link to search and compare health plans. We will provide a demonstration with that tool in a few moments. On the right-hand side of the page is dental and vision open enrollment information. Also included on this page is their health plan and premium for the current year as well as the upcoming year. This information provides both member and employer share along with their current enrolled health plan. Just under the plan and premium information is the dollar amount indicating the employee's increase or decrease between the current and future years if they do not make a plan change. Please note the employee share can vary based on the employer's contribution. Also included in this area is another quick link to the Search Health Plans tool. As mentioned before, we will demonstrate this feature in a moment. If your employee is keeping their current plan, no action is necessary. We do recommend your employees review their health plan information as aspects of their coverage may change. If your employee is looking to make a change, they may consider these factors to help them make an informed decision. This includes their cost, availability, and covered benefits. There is information to assist your employees with things they need to know. Your employee has many resources to help them choose the right health plan. For all the information they need, quick links are readily accessible for them to gather important information, such as Open Enrollment Newsletter, Plans and Rates webpage, publications, and the tool to search health plans. As mentioned before, we will now demonstrate the Search Health Plans tool. Members may use a direct link to the page or can locate the tool from any spot within their CalPERS account by clicking on the Health tab and selecting the Search Health Plans option. Here, we notify members that doctor availability is subject to change and searching for their doctor does not automatically assign them to that doctor. Members must accept these terms of use to begin their search. The search criteria pre-populates with information we know about your employee. This information can be adjusted if needed to produce different results, such as searching by a different zip code. For this example, we have a state employee searching for a basic one-party plan. Once the member confirms criteria, they will need to select the Search for Health Plans button that then displays the option to search for a doctor. If they select No, they can click on Continue to compare all health plans that met the indicated search criteria. If they choose the Yes option, they may select a certain mile radius by using the drop-down menu. The default is 20 miles. Then they'll enter the first or last name of the doctor they are searching for. The list of doctors includes addresses and indicates whether they are primary care or a specialist. So they'll select the doctor they're looking for by clicking on the applicable box. For this demonstration, we will select a specialist. By selecting the Continue button, the next page displays the search results. This includes available health plans, member and employer share, total premium, and whether or not the doctor is available. If the doctor is not available within a plan, it will indicate that with a red X and red text. As noted in the terms of use, doctor availability can change frequently. Therefore, it is recommended that members verify availability with the specific health plan. The search results also provide a quick link to the health plan's website as well as the phone number. The results can be sorted by health plan name, price, and doctor availability. Your employee will be able to select up to 3 plans at a time to view and compare information. This is easily done by selecting the View Compare checkbox at the bottom of each health plan. They must then select the Compare Plans button to view the comparison. The results will show the comparison between the health plans selected. There is an option to remove any plan they no longer want to compare. The selected plans will provide a side-by-side comparison of health plan cost, doctor availability, and benefits broken down by services offered, such as hospital, emergency services, physician services, prescription drugs, occupational, physical, speech therapy, acupuncture, chiropractic, and ambulance services. If your employee decides they want to make a health plan change, they can complete the Health Benefit Plan Enrollment Form, HBD 12. and new this year is a pre-populated HBD-12 form. By selecting this link, the form will pre-populate with as much information as possible, such as name, birthday, address, and member information. They can then complete the form based on the change they'd like to make and enter the names of any dependents they'd like to add or remove. They can also e-sign the form and submit to their health benefits officer or personnel based on the instruction you have provided them. We hope you have enjoyed the demonstration of this valuable resource for your employee to explore their customized open enrollment information. Please direct your employees to this all-inclusive resource to help them make an informed decision during open enrollment.
Hi, so this concludes the prepared portion of our webinar. As a reminder, send in your questions using the Q&A panel. We see a variety of questions already, so we'll get to those in a bit. And so I want to let you know that a recording of this webinar will be available on the CalPERS YouTube channel no later than September 14th. So it will be available before open enrollment begins. We will include a link to the recording in future Open Enrollment Employer Bulletin. Also, I want to encourage you to complete the survey at the conclusion of this webinar. This is the first year we've conducted an open enrollment webinar for employers, and your feedback is very important to us. It'll help us plan for open enrollment next year, and we really want to make sure you have the resources you need to conduct a successful open enrollment. So I'll start looking at some of the questions here. So will the CalPERS pre-recorded video be available for us to share with our employees? Yes, this video, this presentation and webinar will be recorded, and it'll be available online by September 14th. There are a few questions about that. Another question is, any CalPERS member eligible to participate in the CalPERS health insurance plan? So a member has to be in a health eligible appointment in a position in order to be eligible to participate in the CalPERS health insurance plan. A question about agencies needing to request a virtual open enrollment presentation. So yes, the virtual open enrollment fairs are available to all employers. You do need to request one because when you send the request, it goes directly to each of our health plans. So each of our health plans is offering a variety of virtual support options, such as videos, PDFs, microsites, webinars, and online office hours, and more. So once your agency requests that virtual support, each health plan will then email you sharing what they offer. Most of the resources can then be shared with your employees directly through either your internal or external website, as well as via email. I have a question about the pre-populated HBD-12. Will the pre-populated HBD-12 include a social security number? We do not want our employees emailing this information, and many are working remotely. So no, the pre-populated HBD-12 will not include a social security number. So a few years ago, CalPERS implemented the CalPERS ID. So this is so we can not have to have that social be out there for everyone. So it'll have the pre-populated CalPERS ID that your employees can then use to look up the member in my CalPERS. This is a really great way now that people can do this because everyone's working remotely, or most of us are, and it also just makes it a lot more convenient for the member. There was another question about the HBD-12 in here too, about will the pre-populated form be available after open enrollment? So yes, it will be available after open enrollment. we're launching it now for open enrollment because this is when we see the most people making changes, of course. However, it will be available year-round when your people have any qualifying events, if you want to allow them to do that. You do need to provide an email address or where they should send it to you so that they know exactly where to send it. Also with that, on all of our health forms, every health form, not just the health enrollment form, CalPERS does accept electronic signatures. So all of them can be signed electronically. You don't need to have the hard copy HBD12 be submitted to you to process anything. Another question, can retirees do their enrollment through CalPERS and take advantage of the e-signature? So yes, they absolutely can. Retirees can actually make their changes online where they don't complete an actual form. They're making that transaction online. And so this is something that we've had for a few years now where retirees can make their changes directly online, and it takes really no intervention from anyone to verify any eligibility if they're just changing from Plan A to Plan B. If they are like adding a dependent, let's say, then that information would come to CalPERS, because CalPERS is the health benefits officer for retirees, and we would process that change for them. Another question: are you communicating the tool usage benefit for retirees? So yes. So the CalPERS tool is communicated everywhere. It's in all of our email blasts to both retirees and actives. It's also in all of our letters that goes out where we guide them. It's also on the health plan statement for those who are still receiving a hard copy of the health plan statement. They'd prefer to do that that route versus the electronic route. It is communicated extensively. Another question. We do our OE through an employee portal, and they do not fill out forms. Is that still okay? It's been the same for many years. Yes, that is okay as long as you're still in your form. It has all of the fields that are on the HBD12. So yes, if you have your own e-benefit system, your own internal PeopleSoft or HCM system, you are totally able to continue to use that and not have your employees go into CalPERS. We offer CalPERS as an option for others who may not have that system already set up. So yes, you can still use your employee portal. One thing to note is that if you still also need to collect any of the supporting documentation. So the birth certificate, the marriage certificate, those types of things still need to be provided. And they can be provided like electronically, like upload PDF, and that's totally fine. Can the employee demo with how to navigate CalPERS be shared so we can give to staff? So yes. The recording of this webinar will definitely be online, and we can even look into just cutting out the part of the member part that we had here towards the end and having that as a standalone item as well. So we will look into that and then share that if we're able to do that through an employer bulletin. Question, if an employee fills out a hard copy of the HB12, do we have to mail it into CalPERS? No. So the hard copy would be retained by you, the employer. So the hard copy HB12 would be retained in your files, and then also along with any supporting documentation. You do not need to mail those. You should not mail those into CalPERS. A question, will the mobile.my.calpers.ca.gov still be available? So the mobile website is actually, we had that launched for the past couple of years specifically for open enrollment. Since then, we were able to update the entire CalPERS for members website so that it is all mobile friendly. So if members go to that mobile website I just shared, it will actually be redirected to the full CalPERS site. So the CalPERS site that members use to log into their account, it's available on any device, whether it's your phone, tablet, computer, anywhere. So all of the information is there all year round, not just the health information during open enrollment. So yes, they could feel free to use any device you'd like to access your information. Another question about the pre-populated HBD12. If we use a pre-populated form online, does it get automatically sent to PERS also? So no. So this is similar to the previous question about what to do with the HBD12. So the HBD12 needs to be kept and retained by you at the HBO and the contracting agency. It does not need to be sent. It should not be sent to CalPERS. When adding dependents, is the Social Security number still required? Yes, I believe it is, and I want to check with my SME. Richard, are you on the line? Richard Ramsey is the manager over enrollment and eligibility areas, and so I want to confirm this question. Richard, are you able to answer if when adding a dependent, is the social still required, please?
Yes, so you are correct. The social is required for all dependents.
Okay, and if they have a CID, a CalPERS ID, would that also be allowed or not?
If they already have a CalPERS ID, then likely they already have a Social Security number in our system, so that should work. If they don't have a Social Security number in our system, we will send out a letter to the employee letting them know that they need to provide that. So eventually they will have to provide it.
Okay. Okay, thank you, Richard. Another question, are we required to gather the HBD12 even if we use our own electronic portal to make OE changes? So no, no you are not. However, you do need to make sure that your electronic portal does contain all of the data elements and fields of the HBD12 as well as some of the disclaimer language that's on the bottom of it. So you do not need to do that in addition to your own electronic portal. It's just very important your electronic portal has all the data fields and disclaimers as the form. Another question here, and Richard, I'd like you to confirm this one. If an employee is declining health, should he or she fill out the HBD12 form? So I believe the answer is yes. They need to fill out the form because on that same form is actually them declining coverage. Richard, can you confirm that, please?
Yes, that is correct, Rob. There's a checkbox on the form they can check where they're indicating they're declining coverage. So they do need to complete it either way.
Okay, thank you. I'm going to make sure I got to the top. A lot of the portal questions. Can retirees do their enrollment through CalPERS and take advantage of e-signature? Yes. Answered that one. Yes, they can. They have all the capabilities online to do everything online. Another question, Richard, to follow up on the declining coverage. Should they decline coverage every year or or only the first time? Can you provide some guidance on that, Richard?
Yeah, just with the initial enrollment is the only time they need to decline coverage and sign that paperwork. If they would like coverage during open enrollment or with qualifying events, they'll need to fill out the form and request it.
Okay, so they only need to decline coverage once, and it continues until they want to actually enroll. That's correct? Richard, can you confirm that they decline once, and then them declining stays into effect until they want to actually enroll in coverage? Is that correct? I think we may have lost Richard here, or he's on mute.
It appears his connection has dropped.
Oh,
I can answer that.
Okay.
This is Anthony. That is true that they basically remain uncovered until they have a qualifying event to enroll. They don't have to keep re-declining.
Okay, thank you. There's a few questions on that. So a question on I mentioned that dependent socials are still required. Does the pre-populated form automatically encrypt the information? So no, the pre-populated form does not automatically encrypt the information. They would need to encrypt the form. It is a PDF, and so it would need to be encrypted if they choose to send that. That's a great question. Great thing to point out. So thank you for that question. I'll take that. Question, Richard. This one is about domestic partners. So do all domestic partners? This is more of a statement. All domestic partners must have a certificate through the state.
Yes, that is correct. They have to have a certificate through the state or an equivalent certificate through the state they live in.
Okay, thank you. Then another one for you, Richard. For COBRA or retiree members, are changes made by the employer. So retirees are going to come to CalPERS for us, and we will make that change. We will help them make the change. The retirees can do it online in their member self-service account, the My CalPERS account, or they can send in the forms to us, and CalPERS will be the ones to process them, as we are the HBO. And then for COBRA, Richard, what entity will do it for COBRA? People are on COBRA.
So COBRA enrollees who were employees or the dependent of an employee, they would go to the employer. COBRA enrollees who were a dependent of a retiree, they would come to us at CalPERS.
Okay, great, thank you. Another question, when changing health plans for the employee and all dependents, does the employee have to submit verification documents for the dependents to make an open enrollment change? So let's just say I'm taking me and my family, or we're moving from Plan A to Plan B. Do I have to provide the eligibility documentation again during open enrollment? Richard, can you answer that, please?
If the employer already has the documentation required, then they don't need to submit it again. If they don't have the documentation, then they're going to have to submit that.
Okay, thank you. Another question, when adding a dependent, do you need a birth certificate even if they have the same last name? So I believe the answer is yes. Richard, can you confirm that, please?
Yes, that is correct.
Yes. Another question, is there any circumstance when we should send the CalPERS HBD-12 form to CalPERS? What if the dependent does not have a social at all? So the first question, no, there is not a situation when you should send an HBD-12 form to CalPERS. The HBD-12 form is the enrollment form for active employees. So this is where you, as the HBO, the Health Benefits Officer, would keep that form. And then, Richard, the second part of the question, the second question, what if a dependent does not have a social? How do we handle those situations?
So we can temporarily enroll somebody in our system without a Social Security number, but it is required, so they will get letters asking for it if it's not in our system. So if you do enroll somebody without a Social Security number, you're going to want to make sure you follow up with that employee to get the Social Security number.
Okay, great, thank you. And then another question about the pre-populated HBD12. Does a change on the pre-populated HBD12 upload to CalPERS automatically, or does the agency rep need to make the change manually? So the agency rep will still need to make the change manually. The pre-populated HBD12 is just a way to help make it easier for the employee and the active member to complete that form and easily send it off to the employer. The employer will then need to look at it and process that change manually in my CalPERS. That's what we have. This is how we have it set up right now. Another question, for new employees that do not have health yet, do we enter the new employee info in my CalPERS so their info will, do we enter their new employee info in CalPERS so their info will be available in my CalPERS? Richard, do you happen to understand that question? I'm not sure if I fully understand it.
Yeah, I'm not sure I quite understand either way. If it's a new employee and they're not enrolling in health, I don't think you would need to enter anything for them.
Right.
Yeah. At least for the health benefit side. Yeah.
Okay. Then another question about a newborn that doesn't have a social yet. I think we answered that. And so Richard, just want to explain what that situation is again, please. How does that handle when a child doesn't have a social?
Mm-hmm. So if you have that situation, just call into the CalPERS contact center. They will assist you to enroll a dependent who does not have a Social Security number. But they're going to remind you to make sure to follow up with that employee to get that Social Security number.
Okay, thank you. And then another question on socials. Do we have to collect a Social Security card or just the number? And Richard?
Yeah, just the number.
Yeah. A question, how do we get the COBIN rates for various bargaining units? So COBIN rates are determined by CalHR, and CalHR will update their website before open enrollment. It was the latest information we have from them. So it will be available on their website. Once they determine them and publish them, we will also add it to CalPERS website onto the various pages that we showed here today, as well as making it available for those members as applicable within their MyCalPERS account. So once we get it from CalHR and it's published there, then we will add it to all of our areas and websites as well as MyCalPERS too. Yeah. Another question on socials. Can a tax ID be used in lieu of a social? Richard?
Yes, it can be used, but it's a temporary situation. So again, you're going to want to make sure you follow up to get the Social Security number.
Okay, great. And then another question about the questions. If our question isn't answered in this session, will we still get an answer? So yes. So any of the questions that are not answered, we're not able to address here, we will be able to address them and follow up with everyone individually. If there's questions like very common questions, I'm trying to pull out the common questions now that we can get. Well, if there are more of those, then we'll send it out or make it available probably through either an email or through an employer bulletin. But yes, we will be able to share. We will get everyone an answer to their question or strive to do so. question about, can the pre-populated form be completed on a mobile? So it can be completed on a mobile if their mobile device can support electronically signing and completing a PDF. So it is a PDF. So not all mobiles are created equal. So if it does have that capabilities, then yes, it can be done on a mobile device. Where does an employee find the pre-populated HBD12? I believe the website, or I'm sorry, the MyCalPERS demo showed that it's available in their MyCalPERS account. So in their MyCalPERS account, as they go through the flow of wanting to compare plans and then make a change, it's at the bottom of that page, and it links them to that, and it'll populate it and actually produce that HB12 through there. So they do need to have a MyCalPERS account and go through that in order to do it. Okay, all right, and a question. In prior years, the system did not seem to pick up the PCP selections entered into the MyCalPERS system. Has this issue been fixed? Anthony and Richard, have we been able to address this?
So this is Anthony. We communicate the information when it is communicated to us. We send it to the carrier. Unfortunately, not all carriers handle the PCP information consistently yet, but we're working on adding that to make it so that it's more consistent, and remind the carriers that when it's transmitted to assign it as the employee requested. However, we only communicate it upon when it's entered for the first time. We don't store it anywhere. So that's sort of part of the issues. We don't just keep it somewhere for them to refer to later.
Okay, thank you. I saw a couple more questions I wanted to get to. We're almost at time. We are at time. Will hard copies of the HBD 110 and HBD 120 be available for plan year 2021? Richard, can you comment on that, please?
I'm not sure what the HBD 110 is. The HBD 120 is our guide, I believe. And that is available online.
Mm-hmm. Yeah, so I'm sorry. If those are our guides, all of our publications are available online. I know the health benefit summary, I don't know what number it is. It's not available yet for 2021. However, it will be online before open enrollment. And agencies can request hard copies if you want to have books have publications available to your employees in your office. Yes, they will still be available. We were just talking to Richard this morning about the new shipment we got in, or the order that we placed. And then is dental and vision coverage available to public school agencies? No, CalPERS does not offer dental and vision coverage to public schools. The dental and vision coverage that is offered to state employees in CSU is actually done through CalHR and CSU. And last question, when is MyCalPERS Open Enrollment Online available for employees? So the online information for employees is going to be available on September 14th. This is where they can go into their MyCalPERS account and view all the information that we showed during the pre-recorded demo. So with that, thank you all once again for attending this webinar. We hope you found it useful. We hope this helps answer your questions about how to conduct a successful open enrollment for your agencies and for all of your employees. Again, I encourage you to complete the survey at the end of the webinar. The survey link will be shown here shortly. And this is the first year we've done this, so any feedback that will be really appreciated. It's very important to us. It'll help us plan for open enrollment next year and also help make doing business with us or interacting with CalPERS as easy and as seamless as possible for your agencies. All right, thank you all. I'll turn it back over to Bill.